everyone, ready for another deep dive. Today we're tackling something that I think a lot of us can relate to, fatigue.
Yeah, and we're not talking about just needing an extra cup of coffee. We're going deep into the world of persistent fatigue.
The kind that really impacts your life.
Exactly. Specifically, we'll be looking at chronic fatigue syndrome and post-COVID syndrome.
CFS and PCS. Heavy stuff.
It is. But we've got some fascinating research to unpack today.
We do. It's a systematic review and meta-analysis that was published in Healthcare last year.
2024. And the big question they're looking at is this.
Can practices like Qigong,
Tai Chi
Yoga.
actually help manage these types of fatigue?
Okay, so let's back up for a second. Just how common is fatigue anyway?
Well, you might be surprised to hear this, but studies show that up to 40% of adults experience fatigue at some point.
40%. Wow, so that's a lot of people feeling drained. But I'm guessing for most people it's temporary, right?
Right. Most people bounce back, but for some, that fatigue lingers.
It becomes chronic. It does. For months or even years. And that's where CFS and PCS come in.
So let's break it down. What are the main symptoms we're talking about here?
Well, both CFS and PCS have some overlap. We're talking about debilitating fatigue. And for CFS, that fatigue has to last for at least 6 months.
And for PCS, it's at least 2 months.
Right, after a suspected or confirmed case of COVID-19. But it's more than just feeling tired. It's headaches, difficulty sleeping, trouble concentrating.
That brain fog thing.
Exactly. It feels like you're wading through mud.
Right, definitely.
And on top of all that, you've got muscle and joint pain, something called post-exertional malaise, which basically means feeling worse after physical or mental effort.
So basically anything you do just makes you feel worse.
Unfortunately, yeah, it's a cluster of symptoms that can really impact your life.
Big time. And this isn't some rare thing, right? Like a lot of people are dealing with this.
Absolutely. Just looking at CFS, the prevalence in developed countries is estimated to be between 0.2 and 1%.
Which doesn't sound like a huge number, but
But that translates to millions of people.
millions, wow. And for PCS.
It's tough to say because we're still learning about the long-term impact of COVID.
But early studies are suggesting that a lot of people are experiencing those lingering symptoms. Okay, well, that's why this research is so important. So the study looked at Qigong, Tai Chi, and yoga,
Yeah.
all of which we could classify as movement-based mindful exercises.
Yeah.
So what makes these practices different from, say, hitting the gym or going for a run?
Well, I like to think of them as moving meditation.
Moving meditation.
Yeah. They emphasize slow, intentional movements, deep breathing techniques, and a real focus on being present in your body, cultivating a sense of calm while you're moving.
It's not about pushing yourself physically.
Not necessarily. It's about cultivating that mind-body connection.
And that's what the researchers wanted to see. Can that connection actually make a difference for people dealing with these specific types of fatigue?
Right.
So,
Did it. Well, this review looked at 13 randomized controlled trials, RCTs, considered the gold standard for research because they randomly assign people to different groups.
which helps control for bias.
Exactly. So the results are usually more reliable.
13 different RCTs? That's a lot.
And they included over 660 participants.
With CFS or PCS?
Yep.
So that's a pretty decent sample size. And the fact that they're all RCTs?
Makes the findings even more compelling.
Definitely.
Yeah.
So what did they find? What did they discover?
Here's where it gets really interesting. The results showed that people who practiced Qigong, Tai Chi, or yoga saw a significant reduction in fatigue compared to the folks who didn't do any of those things.
So compared to people who received no intervention or standard care,
Right, and we're talking about both physical and mental fatigue here.
that's really encouraging. But, you know, we talked earlier about how CFS and PCS involve a whole bunch of other symptoms besides just fatigue.
Yeah.
Did the study look at those too?
They did, and that's
Yeah.
what's so fascinating about this. They found improvements in anxiety and depression
Oh,
and sleep quality, all in the groups practicing these mindful exercises.
hold on. So we're seeing improvements in fatigue, anxiety, sleep. I mean, is this just a coincidence? Or could there be something deeper going on here?
Well,
Hmm.
I don't think it's a coincidence at all. The really cool thing is that we're seeing this consistency across different types of mindful exercises.
So it's not about the specific practice.
It seems like it's more about that combination of movement, breath work, and mental focus. It's like these practices are engaging your nervous system in a way that reduces those stress hormones.
and promotes relaxation,
Exactly.
which then has a ripple effect on energy levels and overall well-being.
Right.
So, okay, I'm hearing you. I'm sold. If I'm struggling with fatigue, I should just find the nearest Qigong class and I'm good to go.
Well, not quite. There are a few things to keep in mind.
Like what?
Well, the study authors did point out some limitations in some of the trials, which is always something to consider.
Yeah, of course. So, should we be hitting the panic button? Are these findings completely unreliable?
No, not at all.
Okay.
It's just about being aware of those limitations when we're interpreting the results.
So, what are we talking about here? What kind of limitations?
Well, one thing that comes up a lot in research on mind-body practices is the variability in how the exercises are actually taught and practiced.
So, like, one yoga class could be totally different from another yoga class.
Exactly. It depends on the instructor, the style, even the atmosphere.
Not all yoga is created equal. Makes sense.
Right. And this variation makes it tougher to draw really firm conclusions.
Or to give people specific advice,
Yeah.
right? Like, based on this one study.
Right. It's not that simple.
Okay, so the overall message is positive, but we need to be a little cautious.
Yes.
And really consider a personalized approach to these practices.
I think that's key.
More research is definitely needed.
Always.
But the takeaway here is that if you're dealing with fatigue,
Especially if it's related to CFS or PCS.
exploring these mindful movement practices could be really valuable.
It's not a magic bullet,
Of course not.
but it could be a helpful tool to have in your toolkit.
If you're trying to manage these conditions, for sure. So, what's the biggest thing that jumps out at you from all of this?
I think finding a qualified instructor is huge EE. Someone who really understands these conditions and can help you tailor your practice to your specific needs.
Yeah, like you don't want to jump into some crazy, intense yoga class if you're struggling with fatigue.
Especially if you're dealing with post-exertional malaise. It's got to be the right fit.
It's got to be sustainable. You got to listen to your body.
Exactly. Finding a practice that you actually enjoy and that works for you.
And that might be different for everyone, right? Some people might love Tai Chi, others might connect more with Qigong.
Totally. And let's not forget about all the different types of yoga out there.
From super gentle to, like you said, really intense.
It's about finding what resonates with you.
And having that guidance from a knowledgeable instructor can make all the difference.
I agree.
So just to recap, fatigue is incredibly common. CFS and PCS are serious conditions that can really impact people's lives, and these mindful movement practices like Qigong, Tai Chi, and yoga seem to show real promise. But we should be mindful of the limitations of the research and approach these practices with a personalized, informed perspective. Anything else we should mention?
I think you covered it really well. It's encouraging, right?
It is. It's hopeful. And even if you're skeptical, I think it's worth considering that even a small amount of mindful movement could make a difference in your life.
10 minutes of focused breathing.
A little bit of gentle stretching.
You never know. It might shift your energy.
Help you sleep better.
Yeah. And maybe even more than that.
It's about being open, experimenting.
Yeah. See what happens.
Okay, so speaking of exploring and experimenting, the study we've been talking about today mainly focused on fatigue, anxiety, depression, and sleep. But the authors did mention some other potential benefits of these practices, things that weren't included in the review.
Oh, right. Like immune function and cardiovascular health.
And there's some research suggesting that these practices can even have positive effects on cognitive function.
Exactly. It's amazing.
And I know I've heard about studies on Tai Chi, improving balance and reducing the risk of falls in older adults.
It's really fascinating how much potential there is here.
Yeah,
But yeah, obviously more research is always needed.
for sure. But there's a growing body of evidence suggesting that these practices could have a pretty broad range of benefits beyond just managing fatigue.
And that's what's so exciting.
It's like you start with this focus on one specific thing.
And then all these other positive changes start to happen, like a ripple effect.
I like that, a ripple effect.
Yeah.
So as we wrap up, what's the one key takeaway you want to leave our listeners with today?
I would say, if you're struggling with fatigue or any of the other symptoms we talked about today, don't give up hope. There are things you can do.
You can take back your energy and well-being.
And these mindful movement practices could be a really powerful part of that process.
But it's a journey, not a quick fix.
Exactly. Find what works for you.
Yeah.
Listen to your body.
And embrace the process. It really is a journey. It's not like you just do one Qigong class and all your problems are solved.
Definitely not. It's about taking that first step, even if it's just 5 minutes in your living room. Just like try it out.
Exactly. And if you're feeling overwhelmed or you don't know where to start,
Yeah,
there are so many resources out there.
there are.
You can find qualified instructors, online programs.
Community classes.
Just ask questions, do your research, and find what feels right for you. Because it might be different for everybody, right?
Oh, absolutely. I mean, What works for one person might not work for another.
Right. And that's okay. That's the cool thing about these practices. They're so adaptable.
Mm-hmm.
So, as we wrap up this deep dive into mindful movement and fatigue,
Mm-hmm.
I want to leave you with this thought.
Okay.
What if just shifting your perspective on movement
Yeah,
could be the key to having more energy and well-being?
it's a good question, right? What if these practices could help you not just manage fatigue,
But actually thrive.
yes, thrive in spite of it.
I love that. So, as always, we encourage you to keep diving deep, keep seeking that knowledge.
And keep exploring.
Thanks for joining us. We'll see you next time.
See you.